Hi, I'm Greg Ingold with Ingold Body Alignment Therapy. Ingold Body Alignment Therapy is a method by which a client can reduce or eliminate physical pain in their lives. Using simple, easy, and effective movements and exercises, you can improve your posture and body alignment. Your body wants to be in alignment. Together we'll get it there. Let's start now. In this episode, we'll be looking at the foot, the ankle, and the lower leg. The lower leg consists of two primary muscles, the gastrocnemius and the soleus, connected to the back of the foot via the Achilles tendon. The ankle is an incredible hinge joint, capable of heavy loads both vertically and side to side. In a functional foot lower leg alignment, the toes point forward with the weight evenly distributed on both feet. Dysfunction can manifest as out-toeing or in-toeing, also known as pigeon-toed. This can lead to a whole host of foot abnormalities, such as pronation, supination, and even flat-footedness, where there is a lack of an arch. To test your lower leg for dysfunction, pinch along the length of your Achilles tendon. If you feel any tenderness or pain, there is dysfunction. Fortunately, there are ways to strengthen and improve functionality in your foot, ankle, and lower leg. One exercise is to lie flat on your back. Pull one leg up by grabbing just behind your knee. In a smooth, continuous motion, make circles with your foot. Go one way and then the other. Do as many as you can in both directions, and make sure it is just your foot making the circles and not your knee. When you are finished with your circles, do at least 10 point and flexes, where you point your toes towards your head and then flex away. You may feel a burning in your lower legs at the end of these exercises. That is a good sign, and it shows that function is being restored. This exercise is also effective at treating shin splints, which is a pain caused by repetitive stress on the tibialis anterior muscle on the front of the lower leg. You can also perform this exercise in a standing position by resting your knee onto a chair or table. Again, just make sure the circles are being done with your foot and not your knee. Now let's look at some effective ways to stretch these muscles. Let's start with the gastrocnemius, which is a muscle that crosses your knee joint and can only be stretched when your knee is straight. If you have a slant board, support yourself against the wall and stretch one leg at a time. Make sure to hold this stretch for at least a minute, as it takes a lot of convincing for this muscle to let go. If you don't own a slant board, the same can be done on a stair or step. Be sure to grab a handrail for support and wear shoes for traction and to prevent strain on your foot. The soleus is a deeper muscle and does not cross the knee. It can only be stretched when the knee is slightly bent. A great way to stretch the soleus is to push against the wall with the leg that you wish to stretch behind you. Make sure your heel stays flat on the floor and your knee is slightly bent. Hold the stretch for about a minute and then slowly ease out of it. Repeat on the other side. Lastly, pay attention to how you walk and run. Your toes should be pointing forward the whole time. Avoid out-toeing, which necessitates a skating-type motion to move yourself forward. This can create knee problems, which we'll address in another episode. And of course, be sure to walk and run with a heel-to-toe motion. This takes proper advantage of the engineering marvels that are your foot, ankle, and lower leg. I hope you enjoyed this video on how to improve your posture and body alignment. Be sure to subscribe to my channel for more helpful videos. See you next time.